This is the breakout session on healthcare. I am Roger Stark. I'm the healthcare policy analyst at the Washington Policy Center, and I too would like to welcome all of you attending this Solution Summit here in Tri-Cities. This is a tremendous event, and we really appreciate your support and your coming. Just real briefly, I'd like to thank our co-presenters this morning, especially the Pasco Chamber of Commerce. Real briefly, I'd like to tell you what we've been doing here this last year in the Healthcare Center. Obviously, like Doc Hastings mentioned this morning, the Affordable Care Act, Obamacare, is extremely important. It's extremely important in the state of Washington as well. So we've been following the Medicaid expansion in this state. We've been following the state exchange. And next year we will be doing those same things. Our legislature is going to have to decide whether they want to continue to expand Medicaid. Our legislature is going to have to figure out how to fund the state exchange. And as, again, Doc mentioned this morning, the lawsuit in front of the Supreme Court is going to be very critical as far as the future of the Affordable Care Act is concerned and how that applies and relates to the state of Washington. Also, just real briefly, the governor is proposing and proposed last session a state-based innovation health plan, which is essentially a top-down, state-controlled plan. He was unsuccessful in getting everything he wanted last session. There will be legislation or bills this session that will address the innovation health plan. We're going to be following that very closely as well. It is my pleasure this morning to introduce Mr. Avik Roy. Avik is a senior fellow at the Manhattan Institute and the opinion editor at Forbes. In 2012, Avik served as the healthcare advisor to Mitt Romney in the Mitt Romney campaign. He is the principal author of The Apothecary, the very influential Forbes blog on healthcare policy and entitlement reform. He is a frequent guest on Fox News, NBC, MSNBC, Bloomberg, and PBS. His work appears in multiple national publications. He is the author of How Medicaid Fails the Poor, and most recently he has authored Transcending Obamacare, a patient-centered plan for near universal coverage and permanent fiscal solvency. Please help me in welcoming Avik Roy.
Thanks, Roger. Thanks for having me, and it's great to be here in Eastern Washington. I did one of these conferences with the Washington Policy Center about 18 months ago now, and it's always great to be here. It's so impressive that the Washington Policy Center invests a lot of resources outside of Olympia and Seattle. I think that's so important and so innovative. Not a lot of our think tank colleagues are doing something similar to that. So that's something I really admire about the Washington Policy Center, and I know you're having a big impact, and I really do enjoy coming out here. Thanks also to the sponsors for having me here. What I'm going to talk to you about today is something I've been working on for a couple years, and it really stems from this basic question. We all talk about free market health care. We say we want free market health care. But how do we get there from here? What does free market health care actually look like? And given how much the government is doing in the healthcare system today, how do you take what we're doing now and transition it in a free market direction in a way that's politically plausible? Right? As you all know, healthcare reform, whether you're a Democrat or Republican, whichever direction you want to move the healthcare system in, it's tough because people like what they have, don't want it to change. That's why the president made that promise. If you like it, you feel like your plan, you can keep it, right? Because he was responsive to that. And of course, he was dishonest in the way he described that. You couldn't necessarily keep your plan. But the same challenges apply to Republican approaches to reforming health care. And so that's what we're going to talk about today. Does this, oh, I have to turn this on, excuse me. So one thing that's really important to understand, and the reason I got involved in this debate to begin with, so I was minding my own business in the private sector, and in 2008, when we started to have the financial crisis and some of the fiscal crises associated with the financial crisis, and I looked at this chart, and what this chart is basically showing you is the Congressional Budget Office's long-term projections of federal spending. And what's the y-axis there is percent of GDP. And what this is showing you is that the blue is basically everything the federal government spends money on other than health care. So that's the military, that's Social Security, bridges to nowhere, highway spending, the National Institutes of Health, whatever you think the federal government should be or not, should not be doing, that's in the blue part of the chart. The red is health care. So that's Medicare, Medicaid, Obamacare, and a few other things. So literally every dollar of growth in federal spending as a percentage of the economy is health care. Well, I'm kind of, it's not just health care, it's also interest on the federal debt. Right? So we're not going to get to 2050 on this chart, right? Because before then, we're going to be broke. We're going to have a financial crisis, interest rates are going to go up, banks are going to default. It's going to be a mess, right? So something will change between the time we get to, this area in the chart. We're not going to get to here, right? This is a point where all the tax revenue that the government collects is not enough to even pay the interest on the debt. At that point, we're effectively in default. And again, this is all driven by health care. So this is how I got involved in this, is that if you actually care about reducing federal spending and dealing with the fiscal crisis that we have in this country, 100% of the battle is health care. You can change things with earmarks. You can change things with whatever you like or don't like about federal policy. But if you don't change health care, you're nowhere. And so you wonder why you have this Republican Congress or you have Republicans in power and they can't actually make government smaller. This is why. Because most of the growth in government spending is on autopilot from health care entitlements. And that's the thing that we have to fix. Does Obamacare make this problem worse? It certainly does. Obamacare spends about $2 trillion over the next 10 years subsidizing health coverage for the uninsured. But if you actually scale down this bar graph and then add in what the federal government was already spending on health care, this is what you see. So if Obamacare, sometimes Republicans like to talk about Obamacare as the government takeover of the health care system. But if this is the government takeover of the health care system, what's all this, right? That's, again, Medicare and Medicaid. So the government takeover of the health care system didn't happen in 2010 when Obamacare was passed. It happened in 1965 when the Great Society legislation was passed by LBJ. That was the moment in which the fundamental relationship of the citizen and the state changed when it comes to health care. And if we want to solve the problem of government overreach in health care, you got to solve this problem, not just this problem. You can repeal and replace Obamacare all you want. That's great, but you're not fundamentally changing the trajectory of growth in government spending on health care if you only look at Obamacare and not the whole system. Here's another way to look at this data. So this chart, I know it's going to be hard to read from the back, but what this chart is showing you is per capita government spending on health care in the advanced economies. And here's something really amazing. So this data is from 2012. So before Obamacare really went into effect. Obamacare spending didn't really come into effect until this past year, 2014. So before Obamacare went into effect, U.S. government spending, federal, state, and local, on health care was more per capita than all but 2 other countries in the entire world. Right? So we think of the Frances and the Germanys and the UKs as these kind of socialist welfare states where, yeah, they cover everybody, but they're broke and they spend too much on health care. Actually, we spend more on health care per capita than all those countries. So that shows you the profound inefficiency of American health care. So the chart that a lot of health wonks will show you, health economists will show you, say, well, total spending on health care in America is much higher than other countries for the same results. And that's fine, we can talk about that if you want. But to me, this is actually a more shocking chart, right? Because this is just government spending. It doesn't even include private spending, which is a whole extra layer that we put on. So the profound cost, the profoundly high price of health care in America is a huge problem, and it is the biggest problem in terms of why we have a fiscal crisis in this country, let alone why there's always a call, constantly a call for more government intervention. Because people say, well, we're spending so much on health care, let's have more government intervention to address this problem. It turns out there are alternative ways to bring health care costs down, and we'll get into that. Here's something else to understand. I mentioned that the government takeover of health care really took place in 1965, and it was driven by Medicare. So basically what Medicare did in 1965 is it said, okay, if you're over 65, we're going to pay for your health care. Yes, there's a certain premium that you pay if you're on Medicare for Part A, the hospital part of Medicare. But the other parts of Medicare are basically free to the user. And so the end result is for every dollar that the typical Medicare beneficiary puts into Medicare through taxes, they're getting $3 out. And like anything in economics, if you're heavily subsidizing the cost of something, people are going to consume more of it, right? If you made a steak dinner $5 instead of $30, probably people are going to consume more steak dinners, right? So the same is true with healthcare. If you actually subsidize the cost of healthcare, what happens? More people want to consume healthcare. And so if you look at inflation, if you just looked at $100 in 1968 and what that would be today because of inflation, it'd be like $700. If you put $100 in the stock market and it grew based on GDP growth, it'd be like $1,700. But if you look at Medicare, $100 that we spent on healthcare in 1968 becomes some crazy number today. Right? And that's driven by the fact that when you make something effectively free, more people consume it. And that's what we've been doing in healthcare, not just for the elderly, mind you. Pretty much everybody in America gets subsidized healthcare from the federal government in one form or another. So yes, Medicare is the biggest. That's this one up here, right? So we're spending something like $700 billion or more on Medicare. We're also spending a lot on Medicaid. So Medicare is the program for the elderly, generally speaking. Medicaid is the program for very low-income individuals, generally speaking, which is also partially funded by the state. So this is state and federal spending. This is not just federal spending here on this chart. And this is Obamacare over here, the Obamacare exchanges. So Obamacare expands Medicaid, as you may know. That's why the Medicaid numbers really start to climb here. But there's another thing that we spend money on, and that is subsidizing the cost of coverage for people who get insurance through their employer. So there are about 150 million Americans who get health insurance through their employer, and that's heavily subsidized through the tax code. So if you think about it, when you get salary or wages, you pay not only income tax on that at the state level and the federal level. Well, you don't pay state income taxes here in Washington, of course, but most people do. I do. I pay in New York City. I pay state and city income taxes along with federal income taxes. You're also paying Social Security tax and Medicare tax on that money, right? So you add all that up, it's a lot. It's like 50% if you add up the income tax and the payroll tax, right? So if you think about it, if your employer gives you $100 in wages, 50% of that goes back to one government entity or another. If he gives you $100 in health insurance, the value of that health insurance accrues to you entirely because the government isn't taxing that at all. It's excluded from taxation. So that's effectively doubling your money, right? So for every dollar you can get in wages, your employer can actually pay you $2 in health insurance. So is it any surprise that employers spend a lot of money subsidizing health insurance that maybe you don't even need because it's $2 instead of $1? Right, for what you're giving that person through their employer-based health insurance plan. So the effective subsidy of that in terms of the revenue, the value of the revenue that's not accruing to governments because you're getting that money in health insurance rather than in income, is about as large as Medicaid. It's basically the third entitlement. It's actually the largest expenditure in the tax code, much larger than the mortgage interest tax deduction. And it's actually the second largest entitlement overall, just second to Medicare, because it's actually larger than even Medicaid. So the point is, you may think that the only people getting subsidized health insurance are low-income people in the welfare kind of system. That's not true. About 100 million people or 90 million people are getting subsidized health care through Medicare, and about 150 million people are getting subsidized health care through the employer-sponsored health insurance system. So we actually spend a lot of money in America subsidizing health insurance for upper-income people. And what does that lead to? It leads to higher prices. So you'll hear a lot of people in the healthcare world say, well, the reason why healthcare is so expensive in America is because we're lazy and fat. We sit around eating Doritos and watching football, not exercising, we smoke too much. That's not actually true. If you actually normalize for those factors, and there are plenty of people in Europe who drink and smoke and eat fatty food, still the price of, it's not so much the fact that our health problems are different than other people that make our healthcare so expensive. It's what we pay for healthcare. So what an MRI costs in Switzerland versus what it costs here. What a knee replacement costs in France or Singapore compared to what it costs here. So for basically the same service, we're paying a lot more. And the reason we are is because none of us are paying for it directly. It's like a cash bar versus an open bar, right? You go to a cash bar, maybe you get the Bud Light or the house wine or whatever because it costs the $5. But if it's an open bar, especially if it's like an in-law's wedding or something like that, you're saying, get me that single malt scotch or champagne or whatever it is, right? Champagne for everybody. And that's basically our healthcare system. Right, our healthcare system is that open bar. You go to the doctor and you say, I want the best care. You know, I paid for it. I have my insurance. And you don't really think about what the actual dollar price of it is because nobody actually tells you. If you even ask what the dollar price of it, sometimes the doctor can't even tell you. Most of the time, the doctor can't even tell you. Right? So is it any surprise in a system where you don't know the price or the value of anything that we basically spend indiscriminately? And so hospitals can get away with charging crazy amounts of money for stuff. Because at the end, you get this bill that you can't even read, and most of it's paid for by the insurance company, so you don't even bother to read it anyway, right? And that is the profound inefficiency in our system. So here's what hospitals have been doing in response to Obamacare and some of the other trends. They've been merging. So you've seen this all over the country, where hospitals are merging and consolidating to make sure that they can continue to charge the highest prices possible to private insurers. And this is an important problem for us to solve because if we want the market to work, markets don't work unless there's competition. If there's a monopoly, that's not really a market, right? So how do you actually preserve competition in the healthcare system in order to ensure that people can actually shop for care and actually insurance companies can fight on your behalf and say, you know, hospital A, if you're charging too much, we're going to take that patient to hospital B, which charges less and has the same quality. Today, that doesn't really happen. And here's the result. So this is a study from the University of California, and they looked at 6 common procedures that are done in hospitals, like knee replacements, heart surgery, things like that. And what they found is that if you divide up all the hospital markets in America into 2 buckets, one where it's a more consolidated market, where it's more monopolistic or duopolistic, and more competitive markets. So the blue bars are in the consolidated markets, the red bars are the more competitive markets. The consolidated markets, big surprise, they charge about 41% to 44% more for the same procedure, despite the fact that their underlying costs are the same. Why? They take advantage of the fact that you have no other option as a consumer. You have to go to that hospital, and they charge more. The hospital industry in America is the most crony capitalist industry literally in the history of the world. You know, people complain about the military-industrial complex. Let me tell you, the government, taxpayers of the United States, spend more per year subsidizing hospitals and the hospital industry than any other industry, including the military, including aerospace. And that is why hospitals have been lobbying for things like the Medicaid expansion in states like Washington. So here's another important chart. I know this chart's kind of hard to read, but what this chart's showing you is these blue bars are the number of M&A transactions, mergers and acquisitions, in a given year. What happened in the 90s? So this is the 90s right here. There was a big spike in mergers because HMOs came onto the scene. HMOs came on the scene saying, hey, we're going to be insurance companies that actually try to push you hospitals to save costs by not doing unnecessary tests and unnecessary procedures. And hospitals said, we don't want to deal with you telling us what to do, so we're going to merge so you as an insurance company have no choice but to do business with us regardless of what we do. Then it kind of went into a lull, and now after Obamacare, it's spiking up again. What this red line is showing you is there's this measurement that economists use called HHI. It's the Herfindahl-Hirschman Index. And that's a measurement of how concentrated a market is, how few or how many players there are in terms of market share. So if you think about it like when Continental and United merged, or when Time Warner and Comcast Cable merged, the FTC, the Federal Trade Commission, Department of Justice, will use this measure, HHI, to figure out whether they should intervene and try to block a merger because it's an antitrust issue or an anti-competitive issue. And what this red line is showing you is that at that point in a normal industry, the FTC and the DOJ almost always intervene in the rest of the economy. And since basically about, I think it's like 1998, I can't really see the numbers here, but I think in the late 90s, we got to a point with the hospital industry where the average hospital market in the United States, which means like a town or a county or a metropolitan area, the average hospital market in the United States was so concentrated that the FTC and the DOJ should have been intervening in terms of an antitrust issue. But they haven't done it because hospitals are seen as pillars of their community that they're helping people, and nobody really starts to think about the fact that hospitals are actually charging an enormous amount of money and taking advantage of their prestige to merge and create these monopolies that then become these gigantic crony capitalist entities. This is a map that's showing you the same thing as here, but basically around the country. So the dark red splotches are the most concentrated areas where, again, normally the government would intervene, and the lighter areas are more competitive markets. So if you zoom in to the Pacific Northwest, you can see really it's more western Washington, though right here in the Tri-Cities we're kind of on the border of that, but it's a much worse problem in Oregon and southern Idaho, if that's any consolation. But this is a problem that's going on all over the country, and it's getting worse and worse. This data is from like 6 years ago. So this problem, these splotches, these dark red splotches are growing and growing and getting darker as time goes on. What are some of the other things that Obamacare is doing to drive up costs? Why are hospitals merging today? Why is that spike happening today? Again, that I showed you in that bar, the blue bars, there's a new spike in hospital mergers to Obamacare. That's because Obamacare expands government health care, which pays hospitals and doctors less than private insurers pay. So what are hospitals doing? They know they can't tell the government what to do, right? The government dictates to them the price by and large. So they're merging to tell people with private insurance what to do. So basically, if you think about Medicaid expansion, what that's doing is because hospitals are being paid less per patient on Medicaid than they would be with private insurance, and because Medicaid and Medicare squeeze out the private sector. If you have private insurance, you're going to pay more under Obamacare because hospitals are going to offset the lower average revenue they get from the government programs by charging people with private insurance more. And this is another way to look at that same problem in terms of doctors. So what this chart is showing you, these are different specialties down here at the bottom. So like primary care over here, OBGYN over here, various surgical applications. And this is telling you, this is again 6-year-old data or 7-year-old data now, the percentage of doctors who will turn you down because of your insurance status. So if you have private insurance, this is the dark blue lines up here, or down here, most doctors will take your insurance. Whatever private insurance you have. If you have private insurance, it pays doctors reasonably well, they'll take it. If you're on Medicare, which is the light blue bars, they're more likely to turn you down and say, you know what, if you're a new patient, I haven't seen you before, I'm not going to take your insurance. If you're already a patient of mine and you go and graduate into Medicare, maybe I'll continue to see you because I have a relationship with you. But if you're a new patient who I haven't seen before, I'm not going to take your insurance. With Medicaid, which is the orange bars, it's even worse. Right, so you can give people this piece of paper, this card that says you have health insurance. But if no doctors actually take it, what does it really matter? Right? So this is the thing about Medicaid, the lie about Medicaid, is that you hear all these people say, oh yeah, we're going to expand Medicaid and all these people are going to have health insurance and it's going to be so great, they're going to have health care. No. A lot of these people can't actually see a doctor because so few doctors actually take Medicaid. And this is why the health outcomes of people on Medicaid are no different, at best, than the health outcomes of people with no insurance at all. Because if you have no insurance, you can pay your doctor in cash. You can say, Doc, I'm going to pay you $100, will you see me today? And a private insurance company might pay more, but the doc has to go through all the paperwork if he's dealing with a private insurance company. If you give him $100 in cash, he doesn't have to do any paperwork. That's great for most doctors. Now, Medicaid, on the other hand, may pay $50, and you as a patient can't supplement that. You can't say to the doc, I know Medicaid only pays you $50, here's another $50 to make it worth your while. That's an illegal kickback, and that'll put the doctor in federal prison. So if you have a child on Medicaid, and you can't find a doctor who will see your child, and you want to say to that doctor, let me give you a little more so I can give you an incentive to see my child, you will go to federal prison for doing that. So that is why Medicaid traps people in poor health care, and that's something we really, really have to try to oppose wherever we can. And so what else does Obamacare do? One of the things Obamacare does is it creates a new layer of federal regulation for people who shop for health insurance on your own. We talked before about people who buy private coverage through their employer, right? Or employers usually buy it on your behalf, and you just get handed this card saying, here's your health insurance this year. But there's a small number of people who buy insurance on their own, and Obamacare tries to expand that through these exchanges, the infamous healthcare.gov website. But what Obamacare also does is it heavily regulates the kind of insurance that you can buy if you shop for coverage on your own. So think of it this way. Imagine if you could if Congress passed a law in which the only kind of car you could buy would be a hybrid car, hybrid engine. Like if you shop for Toyotas, you know that basically the hybrid cars cost more than the same model of the car that isn't a hybrid, right? And no, you might want a hybrid engine. That's great, good for you, and you may save a little on gas, but at the end of the day, you're paying a lot more for the car, right? So you may think it's a public good for us to consume less fossil fuels, but it's going to cost more. Cars are going to cost more. They're going to be less affordable, in fact. Same is true with healthcare. If you make every health insurance plan cover a bunch of things that people don't actually need or use, the health insurance plan is going to cost more. So for example, Obamacare requires that every insurance plan sold in America covers crack addiction. So, if you're planning on being a crack addict, that's great. Your crack addiction therapy will be covered. But for those of us who aren't planning to be crack addicts, that's just extra dollars in premiums that we're spending on something we will never use, right? And there's 10,000 pages of regulation in Obamacare devoted to how insurance companies must deliver their products. And it makes health insurance less affordable and more expensive in most parts of the country. Now, the good news is there are some trends in the healthcare system that are actually moving in the right direction despite Obamacare. One of those is the fact that because healthcare keeps getting more expensive, more and more employers are realizing that a way to actually address that problem is to give their employees, their workers, the money and let them shop for healthcare from a set of plans that maybe they set up and negotiate on behalf of their workers. So instead of just getting this card saying, here's your health insurance this year, maybe you get $5,000 or $10,000 for your family, and the employer says, here's $5,000, here's 12 different plans you can choose from. If the plan you want is more expensive than the $5,000, you have to pay the difference. And that way the company knows how much they're going to spend on health care every year. They're giving you a defined contribution, much like we do now for IRAs and things like that. But you actually have a choice as to which plan you want to buy. And the more that we can introduce those kinds of consumerist concepts in the employer-sponsored market, the better. The more that you're shopping for that health insurance plan yourself, instead of having it bought for you by the employer or by the government, that's a more free market system. Right? So the more we can do to encourage that, the better. And we are moving in that direction despite Obamacare. Another thing that's really, really impressive is the number of large employers that are offering health savings accounts. So health savings accounts kind of are the opposite of our system today. Today, you go to that open bar, you buy the single malt scotch, you don't think about the price at all. With an HSA, you're in control of more of the health care dollars yourself, and insurance really pays for true catastrophic issues. Right? Think about car insurance. When you buy car insurance, so that if you get into an accident, your car gets stolen, you can pay for that, right? The damage to your car or the loss of your car, insurance will pay for that. You don't expect car insurance to pay for your wiper fluid or your gasoline, right? Or your car wash. I mean, if we paid for auto insurance the way we pay for health insurance, everyone would get the super deluxe car wash with the undercarriage designer soap, right? I mean, that's basically what we do in healthcare. But if you have a health savings account where you're controlling that money yourself, you might actually say, you know what, I want to go to this doctor instead of that doctor because that's going to be better for me, and I can I can take those savings every year and roll them over and accumulate a nest egg for myself. So more and more employers are doing this. So in 2003, In 2002, it was basically illegal to have a health savings account. The Bush prescription drug plan for Medicare that was passed in 2003 also contained some provisions that basically made health savings accounts legal. And as a result, we went from like 2% of people offering health savings accounts among large employer to more than 80% of employers in just a very short period of time, in 12, 13 years, right? So this is an impressive and important change because it means that consumers are once again more in control of their health care dollars than they were under the old system, where those health care dollars were controlled by the government and the employer. That's still true to a large degree, much more than it should be, but these are some trends that are going in the right direction. So is there a better way? There are a couple things that are going well, but a lot of things that are going badly, as I spent most of these slides talking about. So let's go back to this thing. There's a political problem here, of course, with Obamacare. So Republican politicians say we're going to repeal Obamacare, right? They still say that. But here's the problem. You know, if we'd had Mitt Romney elected in 2012, we could have repealed Obamacare with a Republican Congress, right? Because no one was yet on Obamacare. The problem is now, as we get into the next set of several years, you're going to have tens of millions of people on Obamacare-sponsored insurance, whether they want to be on Obamacare-sponsored insurance or not. Now, these estimates come from the Congressional Budget Office, and the Obama administration has actually recently kind of reduced those estimates. But still, by the time we get to 2017, so even if there's a Republican president in 2017, a Republican Congress, and you can hold on to the Senate, even if you could do all that, you're still going to have 20 million plus people on either the Medicaid expansion of Obamacare or these exchange website-based plans. And now, a lot of those people were insured previously under the old system, so this isn't people who are newly covered necessarily. Some of them are newly covered, some of them are not. But the point is, if you're a Republican, you want to repeal Obamacare, you're basically saying to this 20, 30 million people that you're taking away their health insurance, and trust me, I'm a politician, I got a better plan for you. Now, what voter is going to trust a politician to give them a better health insurance plan than the one they got? Maybe some will, but history is not kind to politicians who try to take away people's health insurance. So that's one of the challenges that we have in terms of how we want to reform the system and turn it in a different direction. Things really changed with the 2012 election. A lot of people haven't wanted to say that out loud, but I think those of us who study this problem for a living, we all know this to be true. So one way to think about this too that's sort of interesting is Obamacare continues to be unpopular, right? So you'll hear a lot of people say, well, we can still repeal Obamacare because polls show that Obamacare is still unpopular. So this is a poll that was taken this summer. It shows that the American people disapprove of Obamacare by a 54 to 43% margin, and that's pretty typical. So this is what polls have been showing for several years. But what's interesting is if you look at it the other way, which is how many support repeal, it actually flips. Right? So a majority of Americans oppose Obama or don't like Obamacare, they disapprove of it, but a majority actually oppose repeal as well. So that's you kind of scratch your head. Why is that? Right? So there are two reasons for that. The first is that a lot of people who don't like Obamacare don't like it because they're lefties who think Obamacare is too conservative. They want true single-payer health care where the government controls everything. And they're mad about the fact that Obamacare still allows private insurance companies to exist. So actually a majority of the left, the blue side of this pie chart, says Obamacare doesn't go far enough, and that's why we don't like it. So a big chunk of the people who disapprove of Obamacare are not actually conservatives who don't like it. It's leftists who don't like it. The other problem, of course, is that if you repeal Obamacare, it's disruptive. So there are a lot of people in the middle who just say, you know what, I don't want another 4 years of drama about health care. Just let's get it over with and try to, fix the problems that exist. And that's what you see in this poll. So this breaks it out by party, Republicans, Independents, and Democrats, and this is the overall number. If you ask people, repeal the law and replace it with something else versus keep the law or work to improve it, obviously Republicans and Democrats are on different sides of that, but independents, almost by a 2-to-1 margin, say work to improve the law. And you can ask this question in a number of different ways, and you get basically the same answer. So here's another poll that was done recently, a couple months ago, shows basically the same thing, that the middle ground here, the sweet spot, if you're trying to reach out to the middle and win elections and get a mandate for what you want to do to the healthcare system, that mandate comes from being able to say, look, I'm going to repeal maybe chunks of the law, I'm going to roll back chunks of the law, But to repeal every single word of it and uproot so many people, so many millions of people, there's a lot less public support for that approach. So another problem is that even if you didn't care, let's say you ignored public opinion, said, you know what, I don't care what the polls say, I'm just going to go ahead and do it anyway. I'm going to repeal Obamacare because that's what I've promised to do. That's great, but there's this problem, that if you really want to pass any meaningful replace plan for Obamacare, let alone Medicare and Medicaid, you have to have 60 votes in the Senate. You might be able to get away with repealing Obamacare with just a bare majority in the Senate. But to actually really make meaningful reforms to our healthcare system in a free market direction, to make it better, you have to have 60 votes in the Senate. Republicans do not have 60 votes in the Senate. Today they have 54. If they're lucky, they'll have more than between 50 and 54 in 2017, because actually a lot of Republicans are up for re-election in 2016. And a lot of those are in blue states. So Republicans will be lucky if they can hold on to the 54 seats that they have today. They're definitely not going to get 60. There haven't been 60 Republican senators since, like, I want to say 1908. So for more than 100 years, we've not had 60 Republican senators. The Democrats have managed it a few times, but Republicans have not. And so if you want to make changes to health care that can get through the Senate, you're going to have to figure out a way to appeal to at least a handful of Democrats. You don't have to appeal to them all, but you have to pick off, say, 6 or 7 or 8, right? And you're not going to do that by repealing Obamacare, because no Democrat's going to vote for that, unfortunately, right? So you got to come up with some other way to move to a better system. So how can we do that? So let's go back to this chart. This is the chart, remember, that was showing you the amount of government spending per capita on healthcare in a lot of different countries, and how the U.S. is third from the top. Now, there are a couple of countries here in the bottom that are very interesting, Switzerland and Singapore. And we're going to talk about those, because those are actually the two countries that have the most market-oriented healthcare systems in the world. I think a lot of us have had the impression that America has this free market healthcare system. If you're on the left, you don't like that fact. If you're on the right, you do. So, the left, you say we should be more like the Europeans, be more socialist. And we, on the right, say, no, we shouldn't be like the Europeans. But it turns out, actually, at least one European country, Switzerland, has a more market-oriented system than we do. And Singapore, which has the most impressive system of all, is in Asia, of course, but that's a very market-oriented system. They're not libertarian utopias by any stretch, but they're much more market-oriented than the system we have today. So what does Switzerland do? Switzerland has a system in which basically you get these tax credits kind of like Obamacare does, and they're unfortunately heavily regulated like Obamacare's health insurance plans are. But it works for everybody. So in Switzerland, they have these exchanges for private insurance that are more regulated than we would like in an ideal sense, but they're only subsidizing low-income people. So you're not subsidizing the wealthy, and you're doing it on a sliding scale, which is actually really nice, because that means if you make more money, you take an extra job, your subsidy might go down a little bit, but you don't get cut off completely from the help you're getting from the government. So that sliding scale is really nice. And the other important thing, there's no government insurance companies in Switzerland. It's all private insurance companies. So Switzerland, every single person in Switzerland chooses their own insurance plan, shops for their own insurance plan. They don't get it from their employer, they don't get it from the government, and there are no government insurers. And so that's a profoundly more efficient and effective and more market-oriented system than what we have, especially because only about 20% of the Swiss are actually getting subsidized health insurance. So if you're really poor, you get a full subsidy for your premium. If you're moderately poor, you get a partial subsidy. But if you're upper middle class or above, you don't get any subsidy at all. You're actually paying for that health insurance yourself. And that alone, the mere fact that you're shopping for your own health insurance, means that you're going to pay more attention to what that plan covers, how much it costs. Are you really getting a value for the dollar or the Swiss franc, in their case, that you're paying for that health insurance? What Singapore does is they have universal health savings accounts. So they have catastrophic insurance for everybody, where, again, you get hit by a bus, you have a stroke, that's paid for, that's insurance. But for everything else, you have a health savings account that you use to shop for the care that you need. And because the Singaporeans have that control of their own health dollars, they spend a fraction of what we spend, right? So this is, again, government spending on healthcare. If we had the Swiss or the Singaporean healthcare system, we would have no budget deficit in this country, because the entire budget deficit can be explained by this difference between what the U.S. spends on healthcare and what countries like Switzerland and Singapore spend on healthcare. subsidizing health care. Here's another way to think about the same data. So this is from the Heritage Foundation. Every year comes out with this list called the Index of Economic Freedom. You may have seen it. And they rank all the countries in the world by their economic freedom. The U.S. in 2014 ranked 12th. They haven't put out the 2015 list yet. And look who's number 2 and number 4. Singapore and Switzerland. Right? So one of the things I think a lot of us have felt intuitively as well, if you have universal health coverage, that means you're going to base that's game over for freedom in America. But universal coverage and single payer are not the same thing. Right? If you have a targeted safety net like Switzerland does for the very poorest, but you have a market-oriented system for everybody else, you can actually achieve universal coverage, but do so in a free market way. So here's the interesting thing. The United States ranks 12th on this list. 10 of the countries of the 11 ranked above us in overall economic freedom actually have universal coverage. So all this is to say, now we don't want to have the Canadian system necessarily, and we'll cut Mauritius some slack. It's an island off the coast of Africa. Oh, it's okay that they don't have universal coverage, but what I'm showing you here is that you can actually achieve universal coverage through market-oriented ways and actually expand economic freedom. You can cover more people and spend less money if that money is targeted to the people who truly need the help and not kind of this open bar for everyone kind of approach like we have in the United States. So what does Obamacare do? So this pie chart is telling you basically how people have insurance in America. The red part of the pie chart is kind of the commie part. That's the single payer part. So, we think, people ask me if I do talk radio interviews, they'll say, oh, Vic, do you think that Obamacare is the Trojan horse for single payer health care in this country? And you know what I say? I say, guess what? 90 million Americans are already on single payer health care in this country. They're on Medicare and Medicaid. Those are effectively, with some asterisks and fine print, single payer health care. They're government-run health care programs, which the government, by and large, is the insurance company, right? Or the orange part is the people who get insurance through their employers. And as I mentioned, that's not really free market health care because you, as the worker, are not choosing the health insurance plan. That's being chosen on your behalf. The gray part is the uninsured, and the little small sliver, that's the yellow part, are the people who actually shop for their own health insurance. So that's probably the part of the market that's the most truly the market, right, where you're actually choosing the insurance plan you want, just like you would in any other insurance market. So what does Obamacare do? Obamacare expands Medicaid, and it expands, for better or for worse, the number of people who shop for health insurance on their own. It does so, again, this heavily regulated, expensive, kludgy way. But that is something that's important to acknowledge about Obamacare, is that for all its faults, at least there's that element of it. And that was kind of it was a sop to Republicans, say, okay, we won't do it the single payer way, at least entirely. We'll do part of it through single payer, but we'll do part of it through people shopping for coverage on their own. So it's not a Trojan horse. Obamacare, in Title II of the law, it expands single payer health care through expanding Medicaid, but it also allows some people to shop for their own coverage. So what's interesting about that is that for all the yelling and screaming about health care on both sides, there's actually a convergence of Democratic ideas and Republican ideas as to how to reform health care. Think about Paul Ryan's plan to reform Medicare. Paul Ryan's plan to reform Medicare is to basically give seniors the dollars that they now get through Medicare. Instead of getting just health care through Medicare, give the seniors the dollars and let the senior choose the health insurance plan they want. And regulate that insurance plan so that it's somewhat similar to what Medicare covers already. That's actually pretty similar to what Obamacare does with these exchanges, right? So one thing I thought about after the election, after we lost in 2012, was, the Democrats kept giving us a hard time because they're saying, Obamacare is really Mitt Romney's idea. And that's sort of true and sort of not true, and that's a whole other digression. But here's the thing. What if you actually gave people exchange-based coverage, reformed exchange-based coverage, true exchange-based coverage, true market-based coverage, through the Medicare program and through Medicaid? You could do that. You could give people those dollars and let them shop for the coverage they want. Some people call that vouchers. Some people call that premium support. Obamacare calls it premium assistance. And you could do that using the Obamacare exchanges that are set up, though you would do them in a very different way than Obamacare does them. It's kind of a jujitsu move where you say, okay, Democrats, Obamacare is your idea. You think it's really great that 64-year-olds can shop for their own coverage through these exchanges. Why don't we let 65-year-olds do that too? Why don't we let 66-year-olds do it? Why don't we let everyone do it? And if we did that, we'd have actually a system a lot like Switzerland's. So you take this, this gamish of yellow and gray and orange and red and basically turn it all yellow. Let everyone buy the health insurance that they want to buy on their own accord, with some help for the people who are low income and need some assistance. So there's a very simple way to do this, and I describe this in a white paper that I've published through the Manhattan Institute called Transcending Obamacare. Basically what you do is, the first thing you do is you deregulate the exchanges. So right now, as we talked about, the Obamacare exchanges really limit the kinds of plans you can choose from. It basically says you have to buy this one-size-fits-all plan that's really expensive. Get rid of all those regulations and mandates. Get rid of the individual mandate that forces you to buy health insurance that you don't want. Let people buy insurance or even go without insurance if they want, but do it in a way that basically does still help the people who are low income. You can do that. Then what you do is you gradually raise the retirement age or the eligibility age for Medicare. So people who are on Medicare today, nothing changes for them, but for people like me, maybe I don't qualify for Medicare until I'm 72 instead of 65 as I age and get older. But you know what that means is that for those intervening years from 65 to 72, I can still get insurance from my employer. I can shop for coverage on my own. If I'm low income and I need the help, I can get subsidized coverage through these now deregulated, liberalized exchanges. You can do the same thing with Medicaid. You can take this quasi-faux health insurance that no doctors take or few doctors take that doesn't really do them much good, and instead give them high-quality private insurance or the opportunity to buy high-quality private insurance. You can give the people who get Medicaid today health savings accounts to shop for their own coverage. And that way they actually have a stake in their own health care. They not only have better access to physicians, because more physicians will actually take their insurance plan, but they also have a nest egg that if they stay out of the hospital and eat right and live healthy, they can actually build a nest egg, not only for themselves but for their children. And isn't that actually what we want to do with the poor? We want to lift them out of poverty. We want to give them that agency that allows them to say, you know what, I'm going to take this lift up from the government, but I'm going to use that to rise out of poverty and save for my own health care and give my kids a better future. You can do that without spending more money than we spend today on Medicaid, because there's so much waste, fraud, and abuse in the Medicaid program. The next thing you do is just a grab bag of other things that we've always wanted to do. Malpractice reform. Let's reform veterans, care for veterans. Let's tackle the problem of hospital monopolies, as I mentioned before. There's like a whole set of things in the plan that talks about this. But basically it's very simple. To get to Switzerland, the Swiss type approach, all you do is gradually, you deregulate those exchanges, liberalize those exchanges, get rid of the tax hikes and the mandates and the regulations, and then gradually migrate the people who are on the older Great Society LBJ programs into this privatized system. And here's the thing that we found if you do this. So we modeled it out using CBO-style methods to try to figure out how can you actually, what's the fiscal impact of doing this approach, of making the U.S. look more like a combination of Switzerland and Singapore, where people have health savings accounts and everyone gets to shop for their own health plan. Here's what happens. Over the 30-year period, we saved $8 trillion in federal spending, actually federal deficit. It reduces federal spending by $10 trillion, or $10.5 trillion, but it also reduces taxes by $2.5 trillion. So the net deficit reduction is $8 trillion. It makes Medicare permanently solvent, because basically you're paying for Medicare for the people who are on it today, but again, people like me, as they grow older, we will have more private insurance where we pay a greater share of it to some degree ourselves, or we're subsidizing the lower income people but not the upper income people. So through those mechanisms, you actually make Medicare permanently solvent. So people today on Medicare, Medicare is not going to look in 10 years like it does today. It's going to look a lot more like Medicaid, where Medicare pays doctors less and less, and fewer doctors take Medicare because Medicare is paying doctors less and less. Right? So things don't stay the same. Things are getting worse. So if you want Medicare to be solvent, if you want the people who are on Medicare to actually have high-quality access to care, that means you have to do a trade-off, which is to say that for people who will be future retirees in the future, let's make sure that we're taking care of the people on the lower income of the scale, end of the scale. But for upper income people, we're going to rely on them to shop for their own coverage. The other thing that's attractive about this is you actually improve state government fiscal situations. So as many of you know here in Washington and every other state, Medicaid is like the largest line item in the budget. Sometimes education is number one and Medicaid is just a slight number two. But in most states now, Medicaid is the largest item in the budget. And so the more and more we spend on Medicaid every year because health care keeps becoming more expensive, that's less money you're spending on roads and police and teachers. Right? So by doing this kind of a reform, you actually provide an enormous amount of stability to states to actually focus on the responsibilities that they should have in terms of roads and education and police and things like that. But you also cover more people. So this is the thing, you think, well, if we're saving all this money, if we're spending $10.5 trillion less, how could we actually cover more people? Well, it's very simple. By liberalizing health insurance markets, you allow insurance companies to offer health plans that are cheaper, that are less expensive. And if health care is less expensive, it's like magic. More people will want to buy it. If health insurance is less expensive, more people will be able to afford health insurance. And so you can actually have more people with health insurance than we do today simply by making health insurance less affordable than going through this regulate, mandate, subsidize approach that Obamacare does. The other thing you can do is you can really improve the quality of health care for poor people, as I mentioned before, by giving them access to physicians that they don't today. So why is this important? Because as I mentioned about 10 minutes ago, you got to attract some Democratic support for your plan. You can't just go the partisan route. Just because Obamacare was a partisan party line vote doesn't mean we're going to be able to get away with a party line vote in the other direction. And so if we want to pass something, we got to give Democrats something, at least some Democrats, something that they can say, you know what, this isn't a partisan thing, I can actually support this. And that's where expanding coverage and improving the quality of access to health care for low-income people is very attractive. Because it means that we're not just saying we're just cutting the budget. It's not just about the green eye shades. We're actually improving the quality of care for everyone, for the elderly, for the middle class, and for low-income people. So with that, let me yield to questions if we still have some time, Roger. And I thank you for putting up with my PowerPoint. Thank you.